How do we do this? Well, a lot of times our incision's about 3 or 4 inches, if you can imagine, on the front part of your hip. So what we do through that approach, you can see the level of arthritis here. We make a cut into the bone. We prepare the hip socket with a special device, what we call a reamer. Once that is done, it essentially takes all this high level of arthritis out of your hip. Once that is done, now we put in your hip prosthesis or the hip socket. The second stage essentially is where we put in the hip stem. And then one thing that we do with the anterior hip approach as compared to other approaches is that we use x-ray, and that really increases our level of accuracy. And the reason is when we use x-ray, we're actually comparing to your other hip. We want to match your natural anatomy. And so by doing that, when using x-ray intraoperatively, which is not typically done in other hip replacements, we can make sure that we are making sure your leg lengths are appropriate and the hip is designed to fit your other hip so you're not having any challenges when you're walking. So once we do that, then we put in the hip stem, and then essentially we have completed your hip replacement.